Ayesha Verrall is the Associate Health Minister. Afternoon, Minister.
Hi, Heather. How are you?
I'm well, thank you. Sixth person turning up at Middlemore testing positive. Didn't know they had it. Does that worry you?
Yeah, I guess what I used to say when I worked in the hospital was at the hospital, the emergency department is the front door to the community. So when things happen in the community, they do come into the hospital as well. That's why it's really good that the hospital has got a much wider testing of its staff and people who are being admitted to hospital now. And so we picked up one additional person there today, and that's just a sign that the system is working, which is good.
If that person hadn't gone to Middlemore, if they hadn't been tested as part of the new routine swabbing, it's entirely possible that this person might have just gone on to create another cluster, eh?
Well, we did 17,000 tests yesterday, most of them in the Auckland region. So we really are trying to make sure that we run down all of these, cases, identify, do everything we can to find people
but that's
who
possible,
haven't been
isn't
linked.
it?
The trick with this is making sure that we reduce the chance of these rare things going wrong. And that's what Aucklanders have done by staying home and getting tested in really high numbers.
Do you reckon it's rare?
Well, it's
looking less rare every day, doesn't it?
I think it's been it's less frequent this week than it was last. And as we discussed, that's one of the clues that things are getting under control. So, we did have a period of uncontrolled transmission in the community, it looks like
I'm fascinated by that language that you're using and the Prime Minister and Ashley Bloomfield. It's getting under control. That means it's not under control yet.
I think the thing that when you deal with an outbreak, you are dealing with uncertainty. We're not testing. We can't test everyone every day to know about absolutely everything. But we reduce that uncertainty by, sticking to the level 4 lockdown rules. And it's just been so great that Aucklanders have done that to such a high level and by getting tested. It's coming under control, decreasing case numbers. We had only one mystery case today, one unlinked case today, and none for the preceding 2 or 3 days. So these are all really good signs.
That truck driver, when are you going to know where he's been? Because I can imagine that there will be people around Tauranga and all those places he's been to probably a little bit worried right now.
Look, I think if there's anything to follow up on from that, we'll see some locations of interest come through soon. I'm aware that the interview has finished.
Okay, so today?
But there's not always locations of interest to follow up on. So if there are, I anticipate they should be through soon.
Okay. When we move down to 3 in Auckland, which feels like an inevitability, the country will move from 2.5 to 2?
So we're going to try and relax the gathering limits at level 2 because I think that indicates that there is a reduction in
not one,
risk.
Not one.
Yeah, so 1 is a pretty permissive setting, really, and we feel that while there's COVID in the country, that wouldn't be safe, but we can safely let increase the number of people in gathering.
When we are in 2 in Auckland, or 2.5 in Auckland, will the country be in 1 or will they also be in 2?
We haven't decided on that far ahead.
How do you feel about that as an expert?
To be honest, I haven't. I think
you haven't thought about it because I've thought about it.
No.
And they're thinking about it.
Here it is, Heather.
Okay, I'm ready.
3 and 4 are risky settings. I think the difference between 2 and 1 is a lot less. So I think that's a possibility, but we haven't taken a decision on that. And as you know, that'll depend on what the data is telling us at the time.
Last week when you were on with us, you said we would get to 0 in 2 weeks. That's now 1 week away. Are you still confident?
Look, I said that was a possibility because I think you had picked up on some comments of the Prime Minister's and you're worried it wasn't a possibility. I definitely still think it's possible we get to 0. I think one of the things that's happened
in 1 week?
Yeah, that's not what the modelling is telling us at the minute.
What is the modelling telling you?
Still very good chances of elimination. I haven't seen a recent update about when the outbreak will be extinguished. But I think the key thing to keep an eye on is most of our cases are coming from a handful of households now.
All right. Thank you so much, Minister. Thank you. Appreciate it. Ayesha Verrall, the Associate Health Minister.